This is a bonus lecture. We're going to talk about verification of benefits and patient insurance cards. So to start this video, I would suggest, if you have not already watched this video under Module 1, Side A, Session 18, on health insurance and the Affordable Care Act video, I suggest you pause this video and go watch that video first. Only about 4 minutes. And it does a great job at explaining copays and deductibles. So as I go through this next section, I'm going to assume you know what those mean. So if you would like some more information on those terms, watch that video first. But how do we verify health insurance? And I'm going to just use this document I found out on WikiHow website. And I find this is a great document. So we're going to use this, and I've got just a few things to add beyond what they said. So patient comes in or calls you on the phone to schedule, and you get their insurance information. Are we billing insurance for you? Who do you have? You get their numbers. And then you need to contact the insurance company to find out what's covered, what's not covered, how it's covered, so that you know what the patient's going to owe you when they come in. Okay. So in my office, we get all that information on the phone before the patient comes in. As they're scheduling, we get all this information, so that when you come in the door that first visit, I already know this information. I inform the patient prior to them seeing the doctor, so that if there's any surprises, they have not incurred any cost. So if a patient says, I can't afford that, and they leave, nobody owes anybody money. So that's why we always do it first. So the first step is to get the information from the patient. I have to have all this information before I can contact your insurance company. Patient's name, patient's date of birth, who carries the insurance, who is your insurance company, what's their phone number, what's your policy number, what's your group number. I do not ask for a social security number because no insurance uses that number anymore. And people are just really leery about giving that out over the phone, which is fine. I don't need it, so I do not ask that question. Now, you might get out into the workforce and your employer gives you different directions. You got to do what your employer tells you to do. I've been doing this a long time. Back in the day, I did ask that question, but that's been phased out through the years. Okay, so without that information, I can't contact the insurance company. So if I'm in the billing department and my front desk gives me this information from somebody who called, and let's say they forgot to get the date of birth, I'm like, call them back. I can't do anything with this till you get complete information. It was your job to do it. So I give it back to the front desk. They have to call the patient and then give it back to me. When the patient actually comes in, we're going to get a copy of a driver's license and the insurance card. You want to make sure that if the insurance card has information on the back, which most of them do, that you copy the back as well. But that's not until the patient comes in. Then we're going to contact the insurance company. Many, probably all, of the big insurances have websites to do this on. As a doctor's office, I have to be approved to log in. Just Joe Schmo off the street can't log in and look things up. I have to have a provider account. I have to tell them who I work for, and I get a username, password, all that. Then I can log in, whether it's Blue Cross, it's Medicare, it's Cigna, it's HAP, it's United Healthcare, all these big ones. They all have websites. So I don't have to call and talk to a human. I can click on my computer, and there's my information. Now, if that information is confusing, I may then have to call. Or if it's a smaller insurance company that maybe doesn't have a very good website, then I may have to call there too and talk to a human. Either way, online, human, I have the same questions that need answered. They're going to ask me a bunch of questions on who I am. They're going to ask me who I work for, what is the NPI of my doctor. They may ask for my phone number. A lot of times they ask me for the first initial of my last name, all that stuff. Then I give them the patient information, name, date of birth, policy number, etc. And they get it all pulled up, and then I tell them what I'm looking for. I don't need to know everything. I don't need to know every line of coverage this patient has. I only care about what we do in my office. So if I'm doing surgery, if I'm doing diagnostic imaging, if I'm doing chemo treatment, what is it I do in my office? That's all I care about. I don't care about their whole list of benefits. We, of course, want to make sure the patient is going to be covered on the date of service. What day was the policy active? When did it start? Unfortunately, you're not going to know an ending date because many times the ending date is tied to them working, where they work, or if it's Medicaid, like having eligibility. But you do the best you can. We'll talk more about that when you do your Medicaid. And then we want to know not only what's covered, how is it covered? So we want to know if the patient has any copays that the patient has to pay. Because if they owe a $25 copay, we want to know that so that we can collect that the day service is being rendered. So we want to ask, is there a copay? We want to ask, it kind of goes in a weird order here. We want to know if we are in or out of network. It means, did my doctor sign a contract with that insurance company? Benefits are paid differently depending on the answer to that question. So if I am in network, it's paid one way. If I'm out of network, it's paid a different way. Now, working in the billing department at my office, I should know who I participate with and who I don't. So before I even call, I should already know what I'm looking for, in network or out of network. If I have some weird insurance that I don't know the answer to that question, I will ask the person on the phone and say, can you run my tax ID number to determine if I'm in or out of network? Sometimes the person I'm talking to doesn't have that authority, so I'll get both in-network and out-of-network benefits, and then I'll have them transfer me to the provider department to answer the question of which one is the right benefits for me. But it's rare that I don't already know that answer. Okay, so the last screen was talking about the copay. This one's the deductible. If the patient has a deductible that has not been satisfied, I want to know that. Because that means the insurance won't pay anything until that deductible is met, meaning I'm going to collect it all from my patient. So if I have the patient coming in, and let's say they have a $5,000 deductible, none of it's been met, so the patient's going to owe everything, and I tell that to the patient, and they go, well, what's today going to cost? Hard to give an exact answer to that question, because I don't know what's going to be done, but I can give an estimate. Say, well, if we do an exam and an x-ray, it's going to be about $300. If we do this, if we do blood work, if we do a urinalysis, if he does a throat culture, all of that has different prices, and I don't know the answer to that without knowing what doctor's going to do. So you can always ask before any of those tests are run. So we want to know about the deductible. We talked about copay, but then there's also coinsurance, which is a percentage. A copay is a fixed dollar amount. A coinsurance is a percentage. So the more expensive the service is, the higher the coinsurance would be. Be prepared, this is a great slide. Be prepared to explain this to your patient. They may not understand what a deductible is, or why my deductible's met. Why do I owe you a copay? They may not understand how this works. So you have to be prepared to educate your patients on their own insurance. Okay? A lot of people don't understand how it works. It's confusing. The next question is, does the patient have more than one insurance? That makes a difference in this whole picture. The things that aren't on this slide that I want to make sure we bring up is referrals. Does the patient need a referral from their primary care physician? kind of important that I need to know that. Some services require pre-authorization from the insurance company, where it's not permission from the doctor, it's permission from the insurance. So if I'm going to order an MRI for one of my patients, most insurances require that to be pre-authorized. So that's a step that has to take place so that the claim would be paid. Okay. The next thing I want to point out is limitations. Are there any limitations on the service you are providing? For example, a patient's policy may limit them to 12 chiropractic visits a year. It may limit them to that they can't get mammograms until they turn 35. Anything younger than that's not covered. They may be limited to one colonoscopy a year after the age of 50. They may be limited to things like that. If the service you are performing regularly has limitations from insurance, that's something that's very of interest to you to find out. So, all of these are questions we need to ask of the insurance company, hopefully before services are rendered. The last thing you want to do is do some test and find out it had to have a referral and you never did that. You're probably going to have to write that off. Do a lot of those and you may not have a job anymore. So those are all concerning if you aren't getting this information. You can't do what you don't know to do. So get the information. The next thing I want to show you is just a sample insurance card. This is one out of one of our workbooks. So this is a fake patient. But this is a card from Blue Cross of California. And you can see that we have a picture of the front and the back of that card. So we have a patient name, policy number, group number, the name of the insurance company. We know it's a PPO plan. We see a customer service number here, as well as an address for claims. It does say copay $20 in the office, but I'd still call and confirm that. I wouldn't take that because maybe the patient got a new card increasing their copay and they never replaced it in their wallet. So don't take these as gospel. Always verify. And then there's a bunch of phone numbers and addresses on the back as well. This is for pre-authorization. We've got some different information. A lot of times there's a different phone number for mental health. So if that's what you do, you want to maybe look to see if there's a separate number. So this is all the information I can get from looking at the card. All the other questions I have, I need to contact Blue Cross of California to get those questions answered. So every insurance company creates their cards to look however they want. So there is not any consistency in how these cards are going to look unless you're seeing repetitive ones from the same insurance. So if I saw a lot of Blue Cross of California insurance cards, they probably all look alike. But if I got a Blue Cross of Michigan, Blue Cross of Florida, Blue Cross of Georgia, they're all going to look different from each other. Okay. Medicare is going to look one way. Medicaid is going to be different from state to state. And even here in Michigan, I have a number of different ways Medicaid cards can look, and you probably do in your state too. So the more you see patients from these same insurance companies repeatedly, those cards will become more and more and more familiar to you. I believe I have another one here. Yeah. This one also says, this one says Blue Shield of California. Not sure why they're both California, but it is. Again, patient name, policy number, group number, effective date, customer service phone number, and I see no address on this one, although that's a lot of little print there on the back side. Let's see. Yep, reading glass time. It really just is called customer service number on the front of the card, and it does show that it's a PPO plan. Okay. So, let me talk a little bit about how Blue Cross works. If you are a Blue Cross provider, means you're in network, which almost everybody is because there's so many Blue Cross patients across the country. You are always going to deal with your own state's Blue Cross, no matter where the insurance is from. So this is Blue Shield of California. I still bill it to my own state. I don't send that claim to California. I send it to Michigan because that's where I am. Michigan will send it to California for me. Okay? Then California will tell Michigan what to pay, and the payment will come on my Michigan check just like everybody else. Now, I usually will have students say things like, well, how often do you see out-of-state people? I want you to remember, when we deal with out-of-state Blue Crosses, we're not dealing with people who are visiting their family and on vacation. And yeah, there's those people. But mostly, people have insurance from their employer, but that insurance can be from anywhere. And our world is getting smaller, meaning we work for bigger companies that are not based in the state we live. But yet I live here, I work here, but my employer is based in somewhere else. Those are the times you're going to see those out-of-state Blue Crosses. Good example, Blue Cross of Georgia is where Coca-Cola and Home Depot are based. Blue Cross of Arkansas is where Walmart is based. So obviously, Home Depot, Coca-Cola, Walmart have employees all over the country. They all have insurance from that one state. Okay. So I can see the guy who lives down the street from me who works for Walmart. He has Blue Cross of Arkansas, and but he's not vacationing. He's not visiting. He lives here. And so those are the patients you're going to see with the out-of-state Blue Crosses most of the time. 99% of the time, you're going to deal with your own state. Occasionally, I have to call the other state to verify benefits, but even that I can do on my Blue Cross of Michigan website. Okay, so I want to demonstrate a little bit on verifying benefits. This is the Blue Cross of Michigan website. I have to be registered and have a login, username and login, so you can't just come out here. And the Blue Cross of Michigan website, I think I log into about 15 times a day when I'm doing my billing job. So they call their system called Web Dentist. I'm going to click on there. And it has a bunch of announcements and things, but I'm going to click on, I'm going to click on over here, subscriber information. Eligibility, and I can put in my patient's policy number, and I can get their benefits. Okay, so I'm going to put in my patient's policy number. Before you think I'm breaking HIPAA, that's me, so I'm not breaking HIPAA. Oh, that's an FEP, it's a federal plan, so I'm going to pick federal. And it brings up my policy. Okay, so I blacked out all our dates of birth, not that it really matters, but this is me and my husband and my 4 kids. So it tells us who's on the policy. Now this one is a federal plan. It tells us when they're effective. So when did the policy go into effect? Okay. So if I was trying to see the patients, see the doctor before that, some people will get cards ahead of time. So if their insurance maybe doesn't start until the 1st of next month, like Medicare, if their Medicare is going to be effective on June 1st, they'd already have their card. And I do have Medicare patients who give it to me before it's even active. So you do have to make sure you watch that. So then I'm going to hit benefit description. And it tells us that I have, what's it at? I have the basic option. I have the basic option. There's 2 federal plans. There's basic and standard. And this is not the best type of insurance to do a verification on because you don't get a lot of information here. I'm going to show you another one in a minute. But I'm going to click here on the benefit chart. It takes me to an FEP, and here we go. Here's our basic rates. And so this first part doesn't matter. That's what I pay to have the insurance. But then here's our care. Here's preventive care, routine immunizations, provider care. Here's a whole bunch of copays and things. Okay. So if I have a surgery in a doctor's office, it's going to be $150 is what I'm going to owe. But if it's in a non-office, like I go to the hospital, it's $200. Now, before you think, well, what kind of surgery do you have in a doctor's office? Putting stitches in is considered surgery. Okay? So, there's a lot of services we can do that way. Okay? So, we can go on and on. There's my pharmacy benefits. Here's some accidental stuff. So, if I go to the emergency room or the urgent care, this is what I'm going to owe. So, mental health and substance abuse. Okay, if I need those services. Here's the maternity services. God forbid if I were to need them. Please no. Hospital and facility care. So if I get admitted to the hospital, I'm going to owe $175 per day up to $875. And then I won't owe anything more. So let's say I stay in the hospital for 2 weeks because I have something really, really wrong with me. My bill's going to be $875. Yeah, that's a lot of money, but it could be bigger. At least there was a limit. If it was $175 a day and I stayed for 10 days, that's $1,700. So at least there was a limit. And then other benefits. Okay. So here's just some different federal plans. Okay. Now I'm going to pause the video and I'm going to get another policy number for us to try. Okay, I went ahead and pulled this patient's insurance benefits up to this point. If I had shown you me pulling it up, we would have violated HIPAA. But at this point, this is an anonymous screen so that you aren't seeing who this is on. So this is actually a Medicare Advantage plan. But it here tells us about her deductible. She doesn't have one. Okay. And when we scroll down, it runs through what all the benefits are. Okay. So I'm not going to read them all, but I do want to point out here some of those things that I told you had limitations. Right here, colonoscopy, age 50 and over, for people not at high risk. A screening colonoscopy is covered every 10 years, but for high risk, one every 2 years. Okay, so it depends on what category you're in. How are they going to know you're high risk? Think about that. How are they going to know you're high risk? You put the correct ICD code on it, that's how. You put that they have a history of polyps or a family history of polyps. You did something in that ICD code to tell them they're high risk. Okay. Digital rectal exam for men, which is the start of getting your prostate checked, age 50 and over, one every 12 months. Gynecological routine exam, one every 2 years. Now, those of us ladies who get these more frequently might think every 2 years. You got to remember, this is Medicare. Okay, so you're dealing with a population that's over 65. That's why it slows down at that point. Immunizations covered at 100%. Routine mammograms, starting at the age of 35 to 39, and then 40 and over, one per year. Now, some of you just thought to yourself, wait a second, we said this was Medicare. Why are we talking about 35? Got to remember, if you haven't done that mod yet, people can be on Medicare at younger ages because of disabilities. And so that's why sometimes it kind of crosses those age lines. Okay. Physical exam. Oh, physical therapy requires pre-authorization. There's something we had talked about. And then this is one I do regularly. Radiology, such as MRIs and CAT scans, need pre-authorization. So I would come out and I would only care about what it is I do in my office. So I don't care about pap smears and colonoscopies and things like that. That's not what I do. I focus my eyes on just one thing or two things, depending on what I do in my office. And those are the ones I care about. I'm going to show you one more. Let me pause the video to get it brought up so that we don't violate HIPAA. Okay, so here is my patient, and it starts here by talking about an out-of-network coinsurance. So if I'm in-network, there is no in-network coinsurance. That means the patient has 100% coverage, except for some of those things we're going to talk about in a minute. So that's just the top, where I'm going to just kind of keep that in mind as I look at the benefits. And when I look at her benefits, I run through a bunch of, some of the limitations are the same, like colonoscopies has some limits. This one talks about a copay. Okay, talks about a copay here. Okay, I'm looking for something that talks about a deductible, though. Let me see if I can find. Okay, so let's just say something says it applies to deductible. Although I see a lot of no deductibles, but she does have a deductible on her policy over here. So I pulled that up. She has an there we go. She has an out-of-network deductible of $1,000, but she has no in-network deductible. So as long as she sticks to Blue Cross providers, she'll never have a deductible. And she's got very little in copays as well. Now this particular, that doesn't surprise me in this policy. This particular policy, this lady works for one of our local hospitals. So this is a union contract, so they tend to have really good benefits because she's a nurse. So they tend to have worked out through the union some very good benefits. But let's say this was an in-network deductible. Let's say that said in-network. And it might tell me here how much she has used. So this says she has $1,000 deductible. She's used none. She still owes the whole $1,000. However, if she goes to other doctors and some of that deductible's been met, maybe half of it's been used or it's been almost all used. We had a patient come in our office this morning with a $3,000 deductible, and she only has $197 remaining. So she's already met $2,800 on her deductible. So she's got just this much left to go, and then her deductible will be met. So that's important, not just knowing how much the deductible is, but how much still needs to be satisfied. Okay, so I got everything cleared off my screen. So Blue Cross of Michigan allows me to check Blue Cross. Blue Care Network is our HMO here in Michigan. I can look at federal. I can actually tap into the Medicaid system as well. And then the last one there will actually allow me to pull up other states. So I have to put in a little more information. I have to put my doctor's NPI and put in a name and date of birth and all this. And it'll actually tap into other states. And I can usually get what I need right here without having to call. So that's really convenient if I can just do it. It also allows me to work when I feel like working. Because I work from home, I can do this on Sundays, I can do it late at night, and I don't have to be tied to hours that people are open. So that's really convenient for billers who kind of work flex hours and things like that. So it's really helpful. So I hope you picked up some tips here and can use that when you get out into your externship.